think the good news is that I don't have that much for you this week. And I've said that for a few weeks in a row now, which I think is a good thing, right? So just let's talk about a couple of things. This has not changed. The OSHA ETS, the vaccine or test requirement for large employers, we know has been withdrawn by OSHA. The vaccine mandate for healthcare workers is in effect per the US Supreme Court ruling, and we're still waiting to find out what's going to happen with federal contractors. The government has come out and said they're not going to enforce it this time. Makes sense, right? Because the court rulings have it on hold. But stay tuned. I really thought here we are on February 22nd. I thought weeks ago we would have had an answer to this. So let's see what happens. And just to touch on this, I told you guys a few weeks ago, some of the big international labor and employment law firms like Littler and Fisher and Phillips are tracking how many lawsuits have been filed in this country in federal and state court related to COVID. And the number now is over 5,000 since March of 2020, which I don't know if that sounds like a lot to you or not, but certainly if you are one of those lawsuits, it's significant. And this is one I just saw in the news to give you an idea of what kind of suits we're talking about. So it's a former professor at a school in Georgia, sued claiming he was wrongfully fired for asking to work remotely during the coronavirus due to his compromised immune system. And so basically what he's saying is, I asked for a reasonable accommodation under the ADA. I had a disability, some sort of a medical condition that compromised my immune system. I asked for the reasonable accommodation of working from home and I was denied. And then or actually it's not clear if he was denied, but I'm assuming that he was denied, and then I was fired. So it may very well be that there's a reasonable accommodation aspect to this lawsuit, but there's also a retaliation aspect to this lawsuit. And so it's one of the things I've been talking to you guys about for a while. And I say this when I do anti-harassment training, it's not always the crime, it's the cover-up. You really need to think about not just if your employees are asking for reasonable accommodations, what happens afterwards? Let's assume you either can or cannot reasonably accommodate them, but they continue to work for you. What's going to happen at that point? So you really need to think about all of that and think it through. And again, talking about going back to the office, I just saw, so we've talked about American Express and BNY Mellon, just to give you an idea of what large employers are doing. I also saw in the news recently a bunch of the large law firms who largely have been closed for this entire 2 years, or had their physical offices largely closed for the last 2 years, or have let people come in when they want to. They're opening up their offices and starting to require people to come back 3 days a week. I actually was just talking to someone at my former law firm. I used to work for Pepper Hamilton, which is now Troutman Pepper, and they said they're starting to come back 3 days a week as well. So it is the trend. What are we thinking about if we're thinking about doing those things? Just keep monitoring what's going on with the CDC, what's going on with the Department of Health. I still think a written safety plan is a good idea. It doesn't have to be the 5-pager that we were doing 2 years ago, but a 1-page document letting your employees know what you're doing around safety. Because remember, the employer still has a duty to provide a safe workplace under OSHA. And the things that you're thinking about to put in that plan, what are we doing around social distancing? What are we doing around masking? What are we doing around vaccination, possibly testing? And of course, the protocol for positive test and exposure. I think it's really good to have that protocol written down so people know. I had mentioned last week, OSHA has issued some FAQs around masking that you might find helpful if you're trying to make a decision now. Are we going to keep masks, get rid of masks, re-implement masks? What are we going to do? And obviously, so much of this is going to depend on your specific workplace and the structure of your workplace, how often people need to come in. A lot of workplaces will stagger. You come in 3 days a week, Monday, Wednesday, Friday. We'll have other people come in Tuesday, Thursday, so that you don't have that high density in your workplace. But I do think you should be thinking about vaccines. That a lot of the excitement over vaccines has died down a bit. But if you haven't done it already, I think it's a really good idea to know the vaccination status for your employees and obtain proof of vaccination. As we've talked about, you are permitted as an employer to ask your employees about their vaccination status. However, if the employee says, no, I am not vaccinated, you're not allowed to ask why not, because that could be a medical inquiry that would violate the Americans with Disabilities Act. Keep in mind that this question does not in any way implicate HIPAA for an employer. Do you want to issue a vaccine mandate? My guess is you as an employer, if you were going to issue a mandatory vaccine requirement, you would have done it by now. But if you've done the vaccine mandate and you haven't really talked to your employees about boosters, do you want to add that into the mix as well? Keep in mind that these lawsuits so far have gone in favor of private employers. Recently, I saw the Philadelphia police mandate was upheld by a panel of arbitrators. Of course, anytime you have a policy, whether it's if you're going to have a mandatory vaccine policy, you have to allow for reasonable accommodation for disability and religious reasons. But if no mandate, I still think most employers want to be encouraging vaccination. It's back to that carrot and stick discussion we were having, I don't know, 6 months ago. And either way, I really think it's a good idea to have a written vaccine policy, and we do have samples for our members. We do have samples in our portal. Obviously, if it's mandatory, got to have a policy. But even if you're just going to encourage vaccines, I really think it's a good idea to put that in writing and let your employees know. You can give information there about the fact that the vaccines have been proven safe and effective. You can put statistics in there, and really think about, when we're talking about carrots and sticks, think about, one of the best carrots, and there was a time where we were talking about gift cards and we were talking about bonuses, but one of the best carrots is employees may not want to get vaccinated in part because they don't want to take time off to get vaccinated. So give them paid time off to get vaccinated, or they might be concerned they might have an adverse reaction and they'd have to take, time out of their PTO bank. So give them time to recover from the vaccine as well. And one of the questions we had early on with vaccination was, well, how much time should we reasonably give people? And the OSHA ETS, which obviously no longer exists, gave us some good information on that. It suggested 4 hours to get a vaccine and then 2 days to recover. So that's not a bad guideline for any employer to follow. And then I've just kept these slides in there, kind of my gift to you. If you want to know what the latest and greatest is around CDC isolation and exposure. Okay, so I'm going to look in here and just see if we have any questions. A lot of comments on Russ, that he was excellent, and I agree. I thought that was a really great presentation. He crammed a lot of information into a very short period of time. So someone has said New York State put the booster mandate on hold. Any updates on New Jersey? I've not seen an update on what New Jersey might be doing around that. But stay tuned, and I can certainly look at that for next week. Okay, so like I said, I don't have a ton for you on COVID this week. I think that's a good thing. Hoping as the weeks go on, we can talk more and more about other things and less about COVID. But thank you guys so much for joining us this week. And we hope to see you next week. Have a great one.